Clean air is vital to all of us, especially to children during their early years.
Dr. Shapiro, a specialist in treating children's breathing issues at UCLA Medical Center, has written a comprehensive guide for parents called Take a Deep Breath. She joins us here this morning. There you see the cover of the book. Doctor, good to have you here with us this morning. You deal with young patients and parents every single day. What are the greatest concerns that parents do have right now when it comes to kids and breathing?
Well, you know, I'm a doctor, but I'm also a mom, so I completely understand what parents are going through. The parents that I see that have the most concerns for their kids are the parents of little tiny babies. Newborns, any little thing that a newborn does, a parent is going to be concerned. A newborn has a stuffy nose, it seems like a problem. So what I always like to tell parents is look at your baby. If your baby looks like they're having a lot of trouble, they probably are. If your baby's comfortable, they're probably okay. The older kids, I see a lot of snoring, and that's a big topic in my specialty.
Respiratory problems, we're learning more and more, have as much to do with nature as they do with the nurture side of things. How much does the environment impact children's respiratory abilities, and also what can you do to prevent problems in your child?
Well, the environment is such a big concern, and thankfully it's actually, the one piece of good news is that it's actually improved. Because of the Clean Air Act in 1990, we have cleaner air. Even in Los Angeles, where I live, where there's a lot of smog, the air quality has improved significantly. So the environment is actually on the upswing as far as improving the air quality. As
far as the air quality in homes, what can parents do to keep that I guess just staying on the same trend, like you said, air quality on the outside is getting better. What about air quality at home?
Well, the inside air quality is also a big concern. Babies spend most of their time inside. The number one thing that we can do to improve the air quality is not to smoke. This is a basic issue. Even if you smoke outside the home, you're bringing toxins inside to the home. The other issue is lead. If you have a house that was built before 1978, you may have lead paint. You don't want to just strip that with a baby at home and spread lead particles all over the house.
Yeah, but there's other things too. I mean, it could be the carpeting. It could be, God forbid, you have mold. And I mean, there's so many different things that can basically put you on a downward.
New carpeting, especially if you have a new baby and you brought this beautiful area rug for your baby, and it actually can contain a lot of toxins, something called volatile organic compounds. These can be emitted into the air, so you want to air out the room when you get a new carpet if you have a new baby at home.
How concerned should parents be about their children's sleeping patterns and whether or not they do snore?
Snoring is a big problem for kids. It is not normal for a child to snore. A little bit of noise is okay, but snoring can be a sign of sleep apnea. It can affect their health. It can affect their daytime performance. It can affect their school abilities to focus. So snoring, if you are concerned about your child snoring, you definitely need to have it checked out.
Also, you say the kids in daycare centers are less likely to get asthma. Why is that?
Yeah, this is an interesting thing because you think of daycare as filled with all this dirt and germs and that kids are going to get sick, and it is actually true. But there have been some studies that show that if you put a child in daycare very early, it's sort of giving their immune system a little bit of a boost. They're getting extra exposure, they're getting rid of all these viruses, so it's almost like getting allergy shots very early on for kids.
Thanks, Doc. Got to run.
Pleasure.